All right, we are on the air. I'm Jonathan Godis, Mayor, and welcome to our first electronic town hall. We really appreciate everybody in the room coming and showing up. For those who are participating not here in the room, there's probably about 20 people here. We have staff, elected officials, Rick Voorhees, Shelley Cobb, Paul Stepp, Charlie Willman are here on council. We also have Garfield County Public Health and Valley View Hospital, who's going to kick us off tonight to answer questions and talk about the COVID-19 coronavirus. And then after that, we'll have Terry Parch and Matt Langhorst talk about some infrastructure here in town. So with that, we'll begin. Jen Newton will be monitoring the online questions, so fire those off as you are sitting at home in front of your computer. And we will start the question and answers after Public Health and Valley View Hospital get done with their presentation. And we'll start with the people in the room asking questions, and then we will shift to the online folks. So with that, I will turn it over to, who will I turn that over to?
Just go down the line.
Okay.
So my name is Joshua Williams. I'm with Garfield County Public Health. I'm the environmental health manager most of my time. During incident command structure, I'm the logistics chief. And so we're going to just talk today a little bit, and we appreciate Glenwood Springs for inviting us to this, especially with this public venue to get some messaging out. We are the Garfield County Public Health is the lead when it comes to what's called Emergency Support Function 8. So our emergency support functions tie into our emergency operations planning piece. And we're charged with looking at the preparedness and disease management response plans. Garfield County Public Health has set up our public health incident management team. That has been since February 10th, as well as activated our department operations centers. So what that means is in each of we have offices in Glenwood as well as Rifle, and so we've taken over our conference rooms basically and are operating out of there to answer questions and work with partners and as well as each other on staff. So we've been involved in ramping up to this as it's been occurring, and we also are in close contact with our response partners within the county. Mainly we've been answering a lot of questions from partners as it's been increasing in activity surrounding us. We also are increasing our contact with other emergency support function leads in the county, along with their emergency manager that is under the Sheriff's Department. We're following guidelines from the Center of Disease Control as well as CDPHE with this correspondence as well as our own internal planning. Some of our plans that we manage are the Community Disease Containment Plan. We also have a pandemic plan that we update regularly. And part of what we're working closely with our partners surrounding counties as well. So with the activity that is in surrounding counties, we are moving into a period that we have some suggestions that you may have seen, looking at analyzing public events and meetings. And so we'll talk about that a little bit later, but that is in analyzing our plans and looking at, right now, activity in surrounding counties. There currently is still no known cases, confirmed cases that we have in Garfield County. There is testing that is ongoing through our medical providers with the state labs. We do expect this to move into Garfield County based on the activity we're seeing, and that's why we've been ramping up our planning around the clock.
Yes, just a little bit about our current situation in Colorado. There are 15 confirmed cases. Sorry. Oh, I'm sorry. I'm Sarah Brainerd with Garfield County Public Health. I'm the nurse manager of our Rifle office. going back to, I just wanted to jump right in. The 15 positive cases that we have for the state of Colorado, there is one indeterminate, but being treated as a positive. There's just one of those. And the case count for our negative tests is in progress, as well as the total tests that are running. Currently, there are 3 confirmed cases in Eagle County for the United States, a total of 808 confirmed cases with 28 deaths at this point. We expect to see this, as Josh said, moving into Garfield County, so just ramping up our efforts to try to monitor and contain if possible, but really trying to mitigate and control spread. Signs and symptoms of illness include fever, cough, shortness of breath. The incubation period is about 2 to 14 days. It is a novel strain of the coronavirus. People have heard of coronavirus in other ways, and I'll let the provider speak to that probably a little more, and what makes this so unique. Really what we're trying to convey right now is, if you are sick, stay home, wash your hands, keep surfaces clean, consider social distancing. We are getting a lot of questions about, should we cancel this event, should we cancel that event? And without widespread community transmission at this point, we don't feel that we can say we have to cancel everything. When that changes, or if that changes, those considerations and recommendations could change. At this point, we are saying, is it an essential function? Is this something that we really need to do? There are financial implications. There's little kids' hopes and dreams of doing school trips and things that have been planned for a long time. And until we really have that widespread community transmission again, we won't make the hard-nosed cancel this or cancel that. Make the consideration, does this need to be happening? And then really honing in on our vulnerable population and encouraging, if you are sick, not attending an event and potentially putting others at risk. But also, if you're a vulnerable population, being an elderly person over the age of 80, they've really honed in as a high-risk factor, as well as immunocompromised folks receiving treatment for different illnesses and ongoing medical conditions that put you at high risk, would make you want to not attend a large gathering. So those are some of our major messaging. I just saw somebody cough into their elbow, which was good. So again, washing your hands, coughing into your elbow and sneezing into your elbow, being mindful and really staying home if you're sick. I think those are our big points that we want to discuss with you.
Yeah, and I think to go back a little bit to the messaging that we've put out around the advisory for hosting or postponing public events and gatherings. We've been getting a lot of questions around that and working with partners to the community, is that, as Sarah had said earlier, as disease activity increases, those restrictions and advisement around that may increase, but we're really asking you to take a look at your organization's event or gathering and analyze it with these talking points about who's your target population. Is it an elderly population that could be potentially coming to the gathering, as well as immunocompromised or for folks with underlying medical conditions. And what we're doing internally as well is looking at where something that may have been an ask for folks to come in person, is there a piece of that or part of that, similar to this meeting here as a good example, that could be done remotely, I think one blessing we have currently, sometimes it's a curse, but our level of technology that is available for remote meetings has increased in really the quality of being able to do that. I know we use Zoom and other things in our department, so as well as GoToMeeting and some other that we're implementing to try to, even with our own staff, even in staff meetings, how can we keep people where they're at and have those remote meetings and still get what we want out of it. So looking at that, as well as you may see some organizations that are making decisions to cancel events or postpone events, and some of that is due to the fact of protection of their workforce. Maybe they have a higher sensitivity in their facilities where they may have a conference center connected to that as well. And so we are happy to, as public health, work with agencies to try to get to a decision. We are not making decisions for agencies, but we are there in support of, because these are big decisions and we understand that. So I think that I wanted to highlight that piece as well. One thing we're driving folks to for answers is the co-helpline, and that is 1-877-462-2911. That is also available, and that information available through our website at www.garfield-county.com. We have on the main page, you may have to scroll down a little bit, it's not at the top, but there is a link there to PHE and CDC guidance, as well as we have a information blog that you can subscribe to get get tied into the system and responses from. So those are a couple ways you can get answers there. One thing that we're not doing as public health currently in Garfield County is community testing. So we're asking that folks who may be ill or suspect that they may have that, to seek guidance from the medical providers, to call them first, as well as we've got some information that other counties may move in a direction to open up testing at their health department facilities. Some of our partners also have clinics or work to oversee the federally qualified health centers in their community, so they may be partner organizations and they have a medical clinic. We do not see sick people at the health department, and so you may see signage as well that we're asking people to not enter the facility if they are sick and call this number. We will give advice and work them through how they could get connected to a medical provider for testing or for evaluation. So I know that's a key piece we're looking at currently implementing. And that's, I think looking at what we've been doing as a county as well, the hospitals setting up their incident management teams, us setting up our incident management teams, not having virus, in the known virus that's been tested in the county, we're not at a place to set up a emergency operations center just yet, but we're working to see how we can keep these information partnerships open, as well as meetings with these agencies to work through this process. So that may be something that is implemented in the future, but currently is not.
I have a question from, I think it is from the telephone. It says, how is Garfield County preparing for estimated critically ill over 65 years old patients who may need ICU care?
So how about I take this and I'll start by, I'll get to that question in just a second. I'll just say thanks to the city for having us, and Public Health have been great partners in this emerging, evolving infection. I'm going to introduce myself. I'm David Brooks. I'm the Chief Medical Officer at Valley View. I've also been a pediatrician here in Glenwood Springs for about 20 years. I want to introduce Dawn Skopel. She's our Chief Nursing Officer, and Stacy Gabriel, our Chief Information Officer. And we'll kind of take this as a team. But at Valley View, we became very aware of this infection and this evolving issue I would say mid-January, we started having meetings discussing and planning what potentially could be happening. And since that time, we've realized that this is likely going to progress, and so we've set up a thought process of that our goals are containment, mitigation, and treatment. So we've been focusing on those three things in order to serve one purpose, and that is to keep our patients and our staff healthy. At this point, it is critical for us as an organization to keep our most valuable resource, which is our staff, functional and working. And so our actions the actions we've taken have been focusing on maintaining their wellness so that they can continue to treat the community. And so sometimes we hear things about things that we're doing, and we're going to go through those things, but the actions that we've decided have been to that end to make sure that our staff remains viable for our community. So I'm going to have Dawn talk a little bit about some of the things we're doing, and then I can move on to the specific question about preparing for ICU care.
So some of the things that we've done at Valley View, as David had said, we started meeting about this in January and really ramped up over the last couple of weeks. We have our entire ICS team is set up, incident command system, which is not just our executives, it's an entire key stakeholder team. David is on it, he's only one of the providers. We have many providers on it and many nurses. This team is working constantly. We have very specific meetings every day, and then several times a week with external partners as well. But we really have that group organized to continually monitor the information that we're getting. So the information that we're getting from CDC, from CDPHE, there's lots of sources out there, lots of different phone calls and resources for us to be on to manage that information. I want to acknowledge that that is actually one of the most challenging pieces of this entire event, is that it's a dynamic process where things are changing rapidly for us, as well as it's oftentimes very ambiguous. We're given information that doesn't say, do exactly this. It's information that we have to take and say, should we do this or that? And then we ask a question, and oftentimes the answer is, we think you should make the right choice for your area. So again, that's what that whole team of people does, is make sure that we're making the right choice for our area, which is our entire community. David spoke to keeping our staff safe. I certainly don't want that to be misinterpreted by us only taking care of us. It is our goal so that we can continue to take care of patients that need help beyond the COVID virus as well. So some of the things that I think are important to understand is what we're doing. So screening, you guys have probably heard, where we've limited access to our facilities, only 3 points of entry at the hospital itself. Every clinic and the hospital have set up screeners asking questions. So definitions here for us that we've created within our organization so that we make sure that we're all talking the same language. We have screening questions. Those questions are just to identify individuals who might have had contact or some sort of exposure to the COVID-19. We ask a series of simple questions. If they say no to all of them, then they can enter our facility free. If there's some questionable contact with COVID, then we will continue to ask more questions and determine what to do from there. If anybody needs medical attention, they are seen our ER, absolutely, whether they need COVID-19 testing or not. So the next definition that we have defined is specimen collection. So specimen collection, which is being done as Josh and Sarah spoke to in other areas, is where you kind of pull up, and some of the areas are literally doing it like a drive-up service where they're just swabbing, and then that is being sent off to the state to be tested. So that's specimen collection. We have not started that. It's not to say that we wouldn't start that. So far, again, it's one of those things, not perfect direction on what to do. We had a call yesterday with CDPHE and the CHA and very specifically asked, should we be screening patients who have minimal symptoms who don't need medical care? And the answer was no. They can be sent home and given the resources such as the Colorado Helpline and Colorado Public Health to follow up with them and make sure that they're self-monitoring appropriately. So that's what we've been doing. I know that that's a little bit of source of frustration for some people because they want to know if they have it or if they've been exposed. But again, right now, back to what David said, our goal is to contain and mitigate. We are actively discussing, can we set this up in our community to have people tested. So the answer is not no to that. It's just we're not doing it as of yet and haven't been given that directive. And then the last kind of term to understand is the actual CDPHE is doing the lab testing. So right now that is not anywhere outside of state, and some private companies are doing the lab testing, but those labs, once they've been collected, still have to go to state. There also is a backlog. We were told that we would get turnaround in 24 hours. It is taking about 5 days, I think, for our first one to come back. So even if we set up that screening place to collect the lab, to collect the specimen to send to the lab, it doesn't take away the necessity for anybody who thinks that they may have been exposed and has signs and symptoms to really make sure that they are following the guidance of public health and the Colorado Helpline, because we may not know the answer even if we send a test for a period of several days, and they should be containing themselves at that time. I think that was it, or what we're doing and what we're.
I think, as we spoke, our goal, of course, is to keep the hospital working in an order. So we're trying to keep people from unnecessarily exposing staff. We're trying to step up efforts to make sure that we have appropriate PPE equipment for our staff so that they can continue to care for patients. And we are also reaching out and working with public health to coordinate and mitigate any sort of unnecessary exposure. So one good example of this is Sarah and I today had a conversation, what should we do about our most vulnerable population, our nursing homes, our assisted living? And we reached out to them today and said, we want you to take the highest threshold of not letting people come in your doors. They were all very appreciative and very open to that idea. But to answer the question about what we're doing to potentially take care of a sick elderly person, is what we're doing is trying to not get them sick. And so if we can keep them out, we can keep our services running. And so one of the things that comes up often is some people will say, well, this thing is just going to explode. Why are we even trying? Well, we're really trying to flatten the curve, because if we get 20 really sick patients immediately, it puts us over the capacity to care for that. So if we can take those 20 patients and spread them out over 2 months, 10 and 10, we can effectively care for it. So a lot of our efforts are to spread that out over time. And I know that becomes an inconvenience, and some people are saying, well, why do we have to cancel large gatherings, or why aren't we just letting it happen? And that's part of the effort, is to flatten that curve so that our resources can be renewed and used appropriately. We don't want to get into a situation where we're overwhelmed should that happen.
Another important point when we talk about resources and maintaining them, there is very specific guidelines of all the things that the CDC has given us that are very specific. It's the guidelines related to healthcare workers. If healthcare workers get exposed, they can be out for 14 days. The recommendation is if they are not in full personal protective equipment, that they should be out for 14 days. That means if somebody enters a facility and we didn't screen them with our questions appropriately, and they went past, got into our ER, and a doctor and a nurse and a respiratory therapist worked with them, we now have 3 staff members out for 14 days. That is a big deal for us, and we want to, again, make sure that we don't have that happen. We can take care of those patients in full PPE, and we get to continue working normally. So we want to identify those patients so we get that personal protective equipment on. In addition, the CDC guidelines are also very specific about personal protective equipment, and it is higher regulations than what we've seen in many other. It's higher than what we were for the flu and other diseases that we take care of. And so we will go through our supply of personal protective equipment much more quickly with this particular patient population. So again, to David's point of flattening that curve, as you guys I'm sure have heard on the news, there are shortages on everything. So the longer that we can have our supplies of equipment last, the better off we are to continue to be able to care for these patients over time.
Just as a reminder, if you are at home watching this, if you are listening on the phone, if you press number 3, you can ask a question. Star 3, excuse me. And what was the question you asked, Jen, a little bit ago? Was that answered?
I think it was related to preparing for critically ill.
Just a little more in depth on that one. We are always prepared to take care for critically ill patients. For either sides of a facility, we take care of very critical patients. It comes down to the number of patients that we would have at one time, and what that would look like for us. And that again was what David was talking about with trying to flatten that curve so that we're not seeing all of them at one time.
Some people wonder why not just screen everybody. And one of the challenges we have is we have limited testing. So the state has 166 tests per day that they can do at this time. We're hoping it will expand. But if you just do the math, we're a small percentage of a large state. So if we're doing 50 tests and we're just 2% of the population, we're quickly overwhelming our state, and then we're limiting the important tests. So at this point, we're not embarking on low-level testing for that reason. Now, testing may expand, and that may become more meaningful, but we're trying to stay in alignment with Sarah. I now have Sarah on my speed dial, and we talk every single day about these issues. Let's see.
Can you talk about the 3 specific criteria for testing?
Sure.
I think that's important, but I want to make sure I don't get it wrong.
So we'll generally, if you have fever, cough, congestion, and a history of travel to an area with ongoing community transmission within 14 days of onset of symptoms, we consider that need to test. And currently, that includes China, Japan, Iran, South Korea, Italy, and Washington, California, and certain areas in Washington, California have high levels. The CDC, currently on their site, seems to indicate their statement is, at this point, we don't consider much of the United States to have ongoing community transmission, and so that would apply to us here locally. And so other things that would qualify is if you've actually had confirmed exposure to a COVID-19 patient, that would get you tested. And then the last one, which is a very difficult one, is with symptoms, fever, cough, congestion, and exposure to a COVID patient. And the last one is, can be one of the more challenging for us, is severe acute lower respiratory illness. So what that means is if somebody comes in with a severe pneumonia or pulmonary disease and we have no other etiology, we would consider that a potential case. What is important for us is that we recognize that before that comes into our facility. And so that has been one of our big outreach, is talking to EMS, talking to our partner hospitals, Grand River, Aspen, that we need to coordinate those coming in that could potentially turn into a severe illness and quarantine or isolate them before they enter our facility, because as Dawn has alluded, if they come in our facility, a bunch of staff take care of them, and then we say, oh wow, this could be COVID-19, then we've taken out a whole bunch of our healthcare staff. And so that's the challenging one, but I think we have good partnership with our surrounding hospitals and our EMS and great awareness of it.
And I think that's another message we have, a shared message with public health, which is if you are going through these criteria yourself at home, to call ahead. We really need people to call ahead and not just present to the hospital or to any of Valley View physician practices, which include pediatric partners, Roaring Fork Family Practice, internal medicine, women's health are some of the practices that are in our Valley View network of care. So our ask to the general public is to please call ahead and not just present unannounced, because we want to provide the best care for you, but also protect the staff and other patients who may be in that space.
And to that end, when people call us and they say, I've got a little runny nose, a little cough, maybe I had a little low-grade fever, and I think I was exposed, but I'm feeling okay, we actually want you to just stay at home. We don't need you coming to the facility. If your symptoms don't warrant a level of medical care where you need treatment, then you're potentially just exposing others, draining resources. So at this point, our recommendation, and hopefully that's in alignment with public health, is for those asymptomatic or mild symptoms, stay at home, self-isolate, and get better. Because the majority of the people that get sick with this coronavirus, 80% will be asymptomatic or mild symptoms. And so there's no point in utilizing limited resources, taking up time. You'll get better, stay at home, but have the appropriate precautions to step up care should you get short of breath, should the fever last a prolonged time, or should you have underlying medical conditions that do warrant medical care at that time.
So thank you very much to the presenters. We really appreciate everybody coming in. Is there anybody from the audience that would like to ask a question? Yes, sir.
So, from what you said, I understand Valley View may have some capacity, sorts of sharing issues, and much in the same way that Garfield County is talking to Pitkin County. Is it too early to have that dialogue with other hospitals in the area?
We've been having ongoing dialogue daily with Aspen, Vale, and Grand River. So I don't think it's too early. I think we started some time ago, and that ongoing conversation is very, very important.
And even reaching out to our other healthcare partners in the state, so reaching out to colleagues that we have in Summit County and colleagues that we have at university and across Centura, so that we're also knowing what are these other communities doing, especially the communities that have already been exposed to this, and what have they done. So lots of dialogue and great conversation.
And public health works with memorandums of understanding with partners, and regionally we have a healthcare coalition that we work with, and ours is mainly looking at resources, management, planning, but those requests and that connection allows us to work with our surrounding partners in the same manner to look at guidance and as well as situation awareness.
Yes, Shelley.
If someone is, has mild symptoms and thinks they were exposed, how long would they be expected to stay home and kind of self-isolate, quarantine?
The current recommendation would be 14 days.
14 days, okay.
But we would encourage them to use their resources, so Public Health Colorado line, so that they can really talk through what works for their individual case.
And if we really felt that it was a potential case that's mild and quarantined for 14 days, public health would be doing monitoring with that person to make sure that they actually quarantined.
Okay, okay.
And the challenge is it's March, so we have all sorts of other viruses going on.
Right.
As a pediatrician,
Respiratory season.
they're all sick.
Couple of things.
Yes.
One, I understand that it seems to be affecting older people, not really affecting children at this point that we can tell. Is there a reason for that? And then the second question, when somebody does self-quarantine, what do you suggest they do to take care of themselves? That just kind of really keep things.
And real quick, I'll just repeat the question for the audience out there, just because we can't hear up there. The question was, why is it different for children and elderly? The different
Why
rates.
our children do not seem to be affected? What is it that they might know about
And what's the
that?
second question
The
again?
second question is, what do people do when they are taking care of themselves for 14 days? What suggested protocol do you do?
And what do people do when they are self-quarantining for 14 days? What are some protocol for that, other than Netflix?
Well, I'll take the kid one. It's an interesting problem that is not well understood. In many illnesses, like the flu, you generally see two peaks in the very young and the very old. In this illness, they're not seeing a peak in the very young, and they seem to have mild symptoms. There is not a great understanding of why that is occurring, but there are some theories. And two theories, and again, this is just theory, so you can't quote me here, but what is being said is that one is generally as you get older, your immune system deteriorates. It's just a fact of aging. So it could be that the young kid's vigorous immune system is protecting them. So that is one theory. Another possible theory is that we know that kids are always sick. So could there be some sort of comorbid, some co-infection that boosts their immunity? And so there's some question of, because there are 4 common coronaviruses out there, and this is just theoretical, that really cause low-grade infections. And so maybe with the kids getting all these, maybe it gives them some cross-protection to coronavirus. So nobody really knows, is it something unique to their immune system, or is it something unique to the frequency of their exposures? But it is an interesting issue, because in general, you'll see young infants have a similar peak as the elderly, and we are not seeing that. So at this point, kids seem relatively well protected. The highest risk are those elderly, especially above 60, 70, 80, those with comorbid conditions. Men seem to be affected slightly more than women at this time.
And then,
Then the question about isolation.
Yeah.
Sorry.
What measures to take? You know, it's an upper respiratory infection, so I don't know if you guys have anything to add, but I would say, you know, if you're mild fever, you can take a inflammatory, like ibuprofen or Tylenol to help reduce your fever. You can wash your hands. You can stay home. But really, it should not be a severe respiratory illness more than most things. It's when it develops into a pneumonia that you need to seek medical care. And so, again, if you are being monitored through this process, then you would be able to, we would be able to evaluate and advise when that medical care would be necessary.
Most people don't live alone.
Right.
So I'm just trying to think, okay,
No,
so
that's a
I
good
go,
point.
I have coronavirus, what do I do? What kind of things do we?
So ideally, you want to keep what we call social distancing, and the thought is that this virus is droplet spread, so there's generally about a 6-foot distance, and so if you can keep outside that 6-foot window with whoever else is in the house, whether you're staying in that room, that will be very helpful. Hand washing is very good. Hand washing is probably better than alcohol-based gels, but you have to do it appropriately and for a long enough time. Don't touch your face. It's really hard to do once you think about not touching your face, then you're going to want to touch your face. But that's how it's spread. It doesn't appear, and we're taking great precautions, that it's floating through the air other than through droplets, through coughing and sneezing. And so by keeping yourself in a separate room, keeping that social distancing, washing your hands and face, that can prevent the spread. Symptomatically, as Sarah talked about, antipyretics seem to be fine. Rest, eating healthy, so that your body's immune system can take care of it. And then being aware of what precautions, what do I need to watch for that I need to escalate this? And things like shortness of breath. This illness seems to have a propensity to cause a shortness of breath, and that would be a big warning sign that maybe it's time to be seen by a healthcare provider. I would say fever more than 2 or 3 days, depending on your underlying medical condition. And I think there's opportunity to be in contact with your healthcare provider, and we're rolling this out either by phone or potentially through a telehealth visit, so that you can get some discussion about, am I doing okay, should I stay at home? And that is one of the things that we're working on as well, is to expand our availability of telehealth. And I don't want tomorrow the whole community saying, oh, I want a telehealth appointment, but it is one of those steps that we are actively working on. We're trying to take care of what we can today and trying to plan for tomorrow down the road.
We have an online question, and then I think we need to wrap it up because we need to move on. Where can folks find information on Spanish? In Spanish?
Garfield County Public Health has most, if not all, of our documents translated into Spanish, so on our website.
CDC has everything in Spanish.
And CDC has everything in Spanish as well.
All right.
Yeah, I think one thing I want to highlight on that is we have several staff that are bilingual, and this is something that Garfield County even in our other duties with food safety or other, has kind of pushed towards the forefront of getting the documents, make sure they're translated and available in Spanish. So I just want to highlight it as something that we take very seriously and include in our protocol.
All right, well, thank you very much. I really appreciate everybody coming up here.
I just have
Oh.
one question. It's getting warmer out and there's more homeless people, and Safeway's getting quite filled up. You have been by there lately. What are we doing they can't wash their hands very easily, and we don't have the facility, so how is the public health going to address that?
So the question is, what are we doing for outreach to the transient population in town?
Well, I think as part of our planning, there are pieces that address, take that into consideration for us to look at as a piece of our overall management of the disease containment and mitigation. A couple different, we have connections with the Human Services Commission, and actually have a call tomorrow morning with not only in-county partners, but surrounding counties. A large section of that. And so that discussion is continuing. I think there's a few things that we're looking at currently is exposure, as well as, if they're in county versus transient coming through the county, as well as looking at to our partners to help coordinate a situation to where it would get to the point to where it would show impact within that population. So I think we're looking at those partnerships in response to this disease containment plan on how we would move forward through a impact in that community.
All right, well, thank you very much, guys. I really appreciate it. And thanks for coming to Bellevue Hospital. Garfield County Public Health is really informative. If you have any question, give these guys a call. And we now need to transition over to infrastructure. So if Terry Parks, Matt Langhorst want to come up to the podium and maybe give a quick hello, or the table, actually, that'd be great. Just for the public out there, we didn't plan this event specifically around the COVID-19 coronavirus topic, just the timing happened to coincide. We've been planning for this electronic town hall for 3 or 4 months, and so we're glad that it was useful in this scenario, and we hope that we don't have to use it in a more stringent scenario. So, Matt and Terry, why don't you come up?
And I know you guys have a presentation, but we do have a question from online, which is where do you find funds allocated for road construction and schedule for the same? So you might start with answering that question.
Okay.
Terry, you want to try that one?
Sure. So hello, I'm Terry Parchin, the city engineer for the City of Glenwood Springs. We wanted to try this forum as a way to reach a broader audience and explain some of our projects that we're working on, some of our bigger and most immediate projects. The first question we had was, how do we find funding for our large infrastructure projects? Please excuse me. So we actually have a program in place that's been in place for the last couple of years to find grants for our large public projects. It was actually organized and developed by our city manager, and we work with a consultant called Sustainable Strategies out of Washington, D.C. They have helped us greatly in looking for all sorts of grants, from local grants to state and national grants. So one of the projects that I'm working on right now, the South Midland project that we might have heard a fair amount about, it's actually a new section of road. We're rebuilding the road from 27th all the way to the intersection of 4 Mile and rebuilding a new roundabout in that area. We're redoing the roadway drainage, and we're adding a sidewalk onto the east side. That project is actually a very expensive project. It's probably going to be in the order of about $12 million. $7 million of that project is coming from a federal build grant. If you are familiar with large federal grants, they used to be called Tiger grants under the former administration. They're now called build grants, but we were very fortunate as a community to receive a very large grant for that project. In addition, we received funds from Garfield County to help us with some of the intersections. We also received a DOLA, that's with my acronyms, Department of Local Affairs, thank you. The Department of Local Affairs grant to help us with some of the rockfall mitigation on the project. I think those are our main grant sources for that project, but we do, I think, a fantastic job in this community looking for outside sources of funding. In addition, in 2016, the community passed the A&I sales tax measure, and that generated the ability for the city to acquire bond funding for some of our large projects. So that the 27th Street Bridge that we just finished, as well as the South Midland project, will use some of those bond funds that are generated from our sales tax in this community. Anybody have anything to add about other sources of funding?
We reach out for grants for everything. I mean, we have a grant from the state of Colorado for $27,000 for EV chargers. We reach out everywhere. FMLD, Garfield County FMLD helps us out quite a bit. The Cedar Crest project that we'll be talking about a little later, they gave us $200,000 for that project also. So we reach out everywhere we possibly can to find funding outside of the local community and our current resources.
So I will just add a few more details about the South Midland project. We worked on the design quite a bit in the last few years. We are nearly finished with the design. We are working towards an April 10th finish for the design. Like I said, we did receive that large federal build grant, and there's quite a process involved with the design and the construction when you have federal funding. And we are working through the final details of our federal build grant agreement, and they will allow us to begin getting money from them in mid-July. So now we're planning to bid the project probably in August and hoping for a for a November 1st start for that project. It will, go ahead. I was going to say it will affect, moving in and out of the south corridor quite a bit. There are a little over 3,000 people that use that road every day. The design of that project is intended to keep 2 lanes of traffic going at all times. That's not to say that we will not have interruptions. We're going to try to have any one laning that may occur during a really narrow window, perhaps from 10 to 2. When people are mostly at work. We're still working on some of our contract specifications. We're going to have another session with the council to discuss kind of what those final arrangements are so that everybody in the community is aware of how we're going to manage that project, because it will have a large impact. But I think we are on track. We're working through our right-of-way process, and we just have a little bit more work to do there. And again, right now our holdup, if you will, is getting our funding under the build grant agreement. Does anybody have a question? Go ahead.
I have a question on the middle section of Midland. As you know, it's not in great condition either. So is it on the radar also? I don't know, it's not part of this project, correct?
The question was, what are we doing about Middle Midland? I believe that's from 27th Street to 8th Street. And that's not a part of this rebuild scope of work.
So I can answer that question. That's kind of a 2-part answer to it. We went out for the Cedar Crest project, which is a large infrastructure project. It's basically rebuilding the entire subdivision, the water system, West Glenwood Sanitation District, part of that. They're redoing part of their sewer system. We're adding infrastructure for broadband and complete road replacement out there. Those bids came in favorably enough that between some money I was kind of hoarding away for Midland, which is what we call it, and the additional funds from that, I'm going to come back to council after we do a quick RFP and go out for some pricing to hopefully mill and overlay that entire section of roadway. We were looking at doing massive pothole replacements and patching this summer and maybe a chip and seal, but it needs to the point where it needs to be milled and overlaid. We will do another drainage correction over this summer. Last year we came through and scraped the ditches. We need to do a little more than that this year to try to open up the drainage, because that's part of the reason it falls apart. You'll notice several driveways and things that hold water, and it really falls apart at those locations. So it's fixing the drainage, doing a mill and overlay on that, and getting the proper cross slope on the road again to get the water to shed off of it to the drainage structure. So as long as numbers come in favorably, again, like Cedar or Crest did, the intention is to mill and overlay that project prior to the start of the South Midland project so that we can take that additional load that section will probably see and be able to spread it out, and it'll be a safer and smoother travel way.
Perfect, thank you. Terry, I presume that the federal money comes with a whole lot of administrative strings that my guess is would be a tremendous burden for the city to take on.
So the question, what was the question? Sorry. Was it a question?
Do you want to restate that?
The question is, how is the city going to handle the additional administrative burden that comes with the strings of the federal money?
So the question for our viewers is, how is the city going to accommodate the additional administrative burden that comes with the $7 million build grant? Is that correct? Perfect.
So you're correct. We are very cautious and conscious, I guess, of those requirements. We will not apply for any federal or state funding for projects that are under $1 million, because that is a threshold at which we believe the cost of the money outweighs or benefits us more than the cost of the additional design constraints, additional construction management that's required. So for all of our large projects that have federal and state funding, for instance, 27th Street Bridge is one of them, we do have to hire another construction management company. And it comes at a large price tag. It's not without cost. And they usually have to help us staff a project with an additional, I would say, 3 to 5 engineers that are on that project full-time. And they have to be there to inspect every piece of work. They have to be there to inspect all the materials that arrive on the site. They have to be there to do labor interviews, and they have to help us track all of the paperwork that are associated with federal contracts, for instance, Build America requirements, disadvantaged business requirements, so certified payrolls, all of those things are things that we have to be able to keep track of, and then have a final audit and demonstrate that we were in compliance. So yes, it is expensive to accept federal or state money, but for projects that are over $1 million, that's where we start to consider that additional cost.
When we got the build grant, we told council to really think about it as a $6 million grant, not a $7 million grant. But still, it was $6 million we didn't have before.
If anybody else is interested in giving us $1, $2, $7 million, we will do extra work for you. Just let us know what that work is. We'll do it. Any other questions online or in the audience about infrastructure projects? No one wants to know about Southbridge. Okay.
Tell us about Southbridge.
Go ahead, Terry.
We can start with the list. We have a list.
Southbridge is another project that we are ramping up. As many of you are aware that have been in the community for a long time, we've been working on it since 2007. We have been through already one completion of an environmental assessment. We had a lot of comments, particularly from RAFT on that document. We are about to complete the environmental process again. Right now we're scheduled for June 15th to complete that environmental assessment. We're working in parallel with the design for that project, so we are at about a 30% design level for the project right now, and we're also working with CDOT to go through their checkpoints, because eventually we probably will have state or federal funding on that project, so we want to make sure that we're in conformance with all the requirements that CDOT or the federal government would have for us. So for those of you who are not familiar with the project, we actually make a connection with the roundabout that we're about to build for South Midland, there at the intersection of 4 Mile Road and Midland, and we continue south on Airport Road, under the airport, through an airport tunnel, and we then cross immediately on a bridge across the Roaring Fork, and we're landing on the property line essentially between Holy Cross and the Jackson Ranch. We continue with an embankment that takes you up to the intersection. At the intersection of State Highway 82, it's an on-grade intersection. There will be a new signal there from the State Highway 82 side side, there will be a double left off of the highway that will allow you access onto Airport Road and into that network. For the Rio Grande Trail, for those of you who are trail users, the trail will actually go under the roadway platform, so there'll be no interruption to the trail. There will be connections that the project actually has really good, strong connections to the Rio Grande Trail. We'll carry 2 8-foot wide paths all the way from the intersection of South Midland there all the way to the Rio Grande. And then across the intersection, there'll be a pedestrian signal to allow access to Red Mountain. So I think big improvements both from a vehicular circulation, certainly from a fire evacuation standpoint, and then also finally from a pedestrian and bicycle standpoint.
Was any of the previous design work, preliminary design work that was done probably 10 years ago, usable for any of this?
The question was any of the preliminary design work that was done 10 years ago usable for the current project?
So we have kept with essentially the same alignment through this whole process. When they first started with the project, the environmental assessment, I think assessed it was either 34 or 38 different potential routes. Once they settled on a route, we have kept that same alignment, that same line work, that same essentially vertical profile. Where we have spent a lot of time and redesign is at the intersection of State Highway 82. At one point when RAFTA was concerned about the rail corridor and perhaps this project severing their rail banking status, we went through an exercise to design a grade separated intersection. So that looks a lot like some of the things that you see in larger cities. I guess they're here too as well, but with on and off ramps. Essentially would have raised State Highway 82 8 feet above its current elevation to allow for us to cross the Rio Grande Trail, the bicycle trail at grade. That improvement added about $25 million to the project, and it was just too far outside of what we could afford.
Do you want to do Matt real quickly and then Bree for CDOT?
Yes.
Okay.
I have a long list, but I'll try to keep it short at this point. But one thing the South Bridge does do for us, it actually connects some of the utilities we have down there. It completes a water loop, completes some of our electrical infrastructure across the river, because we have a 12-inch water line over by Holy Cross that dead ends there, and we have a 12-inch water line over by Cardiff that dead ends there. It actually completes the loop for us. It helps us a little bit with some of the water supply issues we have in the summertime on the south end of town. We're also looking at a new Cardiff tank down there to help with those too. But it's not just a bridge project. It is actually a utility project also. And Terry's been talking with Public Works and Water and Sewer and Broadband and everybody else to try to make sure if we do this, we got to get everything buttoned up at one time. So it is an extremely large and important project for the city. Some other projects we're working on for this year is obviously the Cedar Crest project. We kind of talked about that a little bit. It's a complete redesign of that and rebuild of that whole entire subdivision. And some people may say, why are you focusing on that subdivision? But due to the fact that we have kind of limited resources for roadway replacements, we have to coincide those with infrastructure projects. And Cedar Crest is in the realm of not great for the water lines out there. We replace and repair water lines in that subdivision all the time. We don't actually flow test the fire hydrants at the top of the subdivision because we were not sure what that flow would do to the infrastructure under the ground, since we have such thin wall pipes and so many problems with it. So we're looking at our roadway projects as a combination of where do we have safety hazards in the city with underground infrastructure, starting with water so we can provide fire flow for housing. Mountain South, which is 13th Street all the way to 10th Street, Riverview up to Walls. So that is the project that's in design right now through SGM. That is another infrastructure area where we have problems. We kept our fingers crossed when the house started on fire on West 12th Street that the infrastructure would hold up while they were using water. We had a lot of drag through on that one where those residents saw a lot of dirt come to their residence because it was a flow that system hasn't seen in a while. And we have a lot of holes out there that we replace. So we're kind of combining infrastructure and roadway projects together. So some people may say, why would you fix the asphalt on Midland prior to starting some of these other projects? But some of them are under design right now. We don't have designs for things, and we can't put things out to bid so it's designed, vetted, and we make sure we're getting the best bang for our buck on everything. In Midland is our heaviestly traveled piece of roadway within the city, I believe. So we have to look at how many people use that roadway also, because it's more damage to cars and infrastructure issues associated with it. But that kind of floats into, we're doing designs on Red Mountain South. We have basically a design done for Red Mountain North, which is 10 streets to the Yampa High School, where we have sewer and sanitary connections and water connections coming off of the main tanks. Both of those infrastructures are really bad when it comes to roadway. And I say really bad, I know there's really bad streets all over town. I just had $50 million, I could fix everything, but then you'd be annoyed because we're fixing everything at one time. We went out and surveyed and in doing some internal Blake Avenue from 23rd Street to 27th Street designs. Engineering department's helping us with that, but we're trying to figure out how to get that project in process also, because it is a really bad roadway at this point. So we are looking at basically every roadway. I get comments all the time of, when are you going to get to my street? Is it on the list? Every single street in this city is on our list. Some are really high up on the list where they're in great condition. Some are really low on the list where they're on really bad conditions, or maybe vice versa, depending on how you will look at that. But as money comes available through DOLA grants, through FMLD, through the street tax that we currently have, through some of the capital monies that we have, we are going after all these projects as efficiently as possible. It's going to take us a little while to get them all. Some of the roadways are complete remove and replacements, like the Red Mountains, the Cedar, Crests. When we get to Glenwood Park, it's drainage and complete roadway removals. Some people ask why we did Mount Sopris. Why did we pull that out and put it back in that one section, other than it was in horrible condition? We wanted to get an idea of what the rest of the roadways are going to be like when we tear them out, and it was a complete removal and replacement, and we had a bunch of mucking because there used to be old ditches that went through that subdivision, and they just literally just pushed dirt into them and plowed right over top of them when they built them. So we actually excavated, I think, 150 cubic yards of just muck to get that roadway back in, and that was just one stretch. So all of these projects add up, and they're very expensive. So kind of gotten off track a little bit. Projects that we're looking at doing this year is Cedar Crest, 22nd Street should be going out to bid here soon, which is a water and sewer issue out for us out there. They're very undersized lines, and we have issues with it all the time. Trying to pick the big ones off this list. We are looking at building a fourth substation in West Glenwood Springs to start helping balancing the load from Glenwood Meadows. Have EV charging stations being put out there. Raft is going to expand their systems. We know that they're getting electric buses. We need to start balancing our loads off of our substations, and we need to add a fourth substation out there. We are obviously going through, if you've been keeping up with the news, a large restructuring, leaving the MOC property and moving departments into different locations, and that is going to happen this entire year and probably into future years as we kind of detail that out. So not only are we trying to keep up with infrastructure projects, design projects, maintenance projects, we're also trying to figure out how to move the departments that are doing those projects at the exact same time. So it's a bit of a challenge, but we're balancing it at this point. And those are kind of the big highlights for the year. Does anybody have any questions on those?
I think we should let Bree go, because we're losing people online.
Go.
And then take general questions.
Go, Bree.
Thanks, everybody. My name is Brianna Starbuck. I'm the Project Public Information Manager for new Glenwood Canyon construction happening this summer, beginning now sort of through October, and that is the I-70 Glenwood Canyon Surface Improvements Project. This is actually phase 7. And this is the section on the westbound deck between Grizzly Creek, or between No Name and Hanging Lake. That's sort of the upper deck. That's a complete resurfacing of that section of road. To do this, we're going to have to move the traffic that is on that upper deck down onto the eastbound deck and put what we're calling the head-to-head detour in effect, which is one lane of traffic in each direction. It's going to be quite impactful, sort of expect delays throughout the summer. Beginning in a couple weeks is when we're expecting that head-to-head detour to begin, the week of March 23rd approximately. Because I know that we've got a lot to get through, I just want to point everyone to, you can sign up for email updates or ask more information by calling or texting 970-618-5379, or by emailing glenwoodcanyon2020@gmail.com, and we can get you more information. We also have a few events coming up in town and online. Tomorrow we'll be at Bluebird Cafe from 8 to 10 a.m. and then we will also be at the Glenwood Canyon Brew Pub Thursday from 4:30 to 6:30. It will be impactful, but this community is very resilient, as we have learned, and we will get through this. And it is a very important project. As we all know, the Glenwood Canyon is an incredibly important piece of infrastructure to our community, for the state, for some would argue the nation. And so we want to keep that in really good shape and make sure that we invest, really strongly in our important infrastructure bits. So again, 618-5379, and I look forward to hearing from whoever has questions.
Anybody online? Okay. Anybody in the audience? Mr. Voorhees, Councilor Voorhees.
Yes. Well, thank you, Your Honor. Elected officials can say some things that staff can't necessarily always say, and that is that when Matt looked at our streets last year, there was $56 million worth of basically rebuilds and repairs that need to be done. And as we look forward down the future, and that was great work, Matt. I mean, I think we have, a number in hand, and we can start talking about that. The city probably isn't going to be able to find $56 million to fix those streets. And grants will get you so far. The good-natured neighborhood sort of folks that are willing to get out there with shovels and pickaxes are only going to get you so far. So, we've got this issue that's sort of looming that we, at some point, we'll need to address if we're really serious about the fact that 70% of our streets are in really deplorable shape. So, just a comment, not a question, Ms. Honor.
Thank you. Yes.
Matt mentioned the list. Is that list online if you want to see where they are in the queue?
What Charlie and Rick, Charlie Wilhelm, Councilor Wilhelm just asked, and Rick alluded to, was the $56 million project list that was developed last year to really quantify the needs on the streets and underlying water and sewer and electric infrastructure. Councilor Wilhelm just asked if it was still online or accessible to the public.
So I'll try to answer that question gingerly. That list was based off of potentially getting additional funds to accommodate for it. I do not have I have a 5-year plan list right now because I know for the next 5 years the city will be receiving street tax money. In 2026, basically, that we're kind of at the end of that conversation. So the list currently is about 5-ish years long. And I have that list going for all of our infrastructure in the city. So, no, is kind of the answer. That list is not online. I don't think the list will make anybody happy if I put it online because that only gets us, let's call it 5 years, let's call it $2 million we get out of that, it's $10 million, it's a $56 million list. We're going to make it very far down the list. So we're looking at where the priorities are for the overlapping infrastructure of water for safety. Are there any electrical needs out there, which the electric fund can help fund all of those things, but where are the safety requirements within the city? And then we start looking at what can we triage with pothole trailers to accommodate getting things farther down the line until a solution other than grant funding becomes available outside of that.
And I appreciate that. We tried the list. I was afraid the public wanted to work the list. I really want to give you a chance to talk about that.
I could put the other list up if we wanted that, but it doesn't really mean a whole lot at this exact moment.
It means a lot in terms of future planning.
It does. It's not an ignored list. It is a list we're moving towards.
It's important that council have the list.
And they do.
Okay.
It's important the council has the money as well.
So I have
We're going to do the best we can with the resources we have. Matt and Terry are great, and they're doing the best we can. But like every local government across the nation, we have constraints.
District 10 has a question.
I do have a question. It's for Bree. It says the I-70 Glenwood Canyon, what communication does CDOT or Glenwood have directed to the Denver area on the safety and open status of I-70, i.e. to commute and continue to welcome our regular visitors?
Can you say that again, Jenny?
It's a question really about information directed to commuters and to Denver folks who are coming here as visitors.
Yeah, so we also are sharing some information to our Front Range media partners, and we'll be placing sort of radio placements to help get the word out there. Glenwood Springs is still open for business for anyone out there virtually. Definitely come and still see us, and we have a good traffic plan coming in. As always, the best way to know what to plan for is to tune into updates. So again, we have those email updates. CDOT has a very robust online system that folks can tune into at cotrip.org is a great resource for not only the Glenwood Canyon, but for sort of statewide travel information. And there are several different mechanisms there where you can draw even where you're interested in knowing what is going on. For this project, a unique feature that we're setting up is called Smart Work Zone signage, where we'll actually have live signs on either side of the Glenwood Canyon and up as you come into Glenwood Springs, down from Upper Valley, saying what your anticipated travel time will be, because part of the burden of going through the canyon, as we all know, there isn't cell service, and so hopefully by knowing what we're looking at in terms of travel time, that will help everyone be able to plan before they actually go into the canyon. But it's still open. Come through. Peak times is always a thing, so whenever folks are traveling to or from work, that's typically when you see the higher volume of cars trying to get through, and whenever you have more cars trying to get through, that is when your delays are longer. So travel in off-peak times. We will also, in this project, after we get through some of this initial work, we are aiming to transition from the head-to-head detour to a 4-day work week with a single lane in either direction after the July 4th holiday, so that we can, on the weekends when, again, peak travel times are at their highest, we can accommodate some of that traffic a little easier. So by doing some of this heavier work at the front, we can help ease the burden during our summer travels.
Do you have an additional travel time expected through the canyon, a travel delay time?
No, so it's difficult to anticipate an exact time. Usually it will take about a week once a traffic impact begins before we know what the approximate number is, but I would say to keep you safe, like start around approximately 20 minutes. I don't like putting a number out there because as soon as I say a number, then that number is going to be wrong, but 20 minutes to start. It might be more, it might be less, but it's a starting figure for everyone to ideate around.
And then I have a question that's not related to that project, and it's maybe a question for Deborah. It's why not scrap improvements to Sayre Park to use the money for streets?
The majority of Sayre Park is currently being funded the first phase by local contributions and park improvement fees. We cannot use the limited amount of money we put as city money, park improvement fees, into streets. It would not be legal. And I would also like to say, parks are also really important to the majority of our community. And we need to figure out how to balance all of our needs.
Any other questions? All right, well, I just want to thank everybody for our first electronic town hall participation. Thank you to Matt Langhorst, Terry Parch, Brandon Stark, Deborah Figueroa up here on the panel. Thank you for Public Health and Valley View Hospital for coming and informing us on the coronavirus and what its impacts are to the community. We hope to do this again in the very near future, and we'll have different topics and different presenters. So we just really encourage folks that can't get out and come here and take time out of their evening to tune us in and to participate. So thank you very much, everybody.
And I would add very quickly, give us feedback if you liked it or not.
Yes. Let us know if this worked for you, if it didn't work for you, what didn't work for you. We did have a comment online that people in the audience should come up and speak. That way we don't have to keep repeating questions. So we'll put that in the file for next time. So thanks, everybody.
you.